Well, hello there, FilipiNARS listeners and followers. Well, here we are again on another episode of our program. And as you know, FilipiNARS is brought to you as a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with our favorite radio station, PHLV Radio. So thank you for joining us today. So, there is an important conference happening here in Las Vegas. It's called the HIMSS Global Conference. And HIMSS stands for Healthcare Information and Management Systems Society. So last year, over 25,000 healthcare pioneers from 88 countries converged to strengthen the future of the industry, from AI-powered diagnostics to revolutionary care health delivery models. The Philippines has emerged as one of the world's most important hubs for healthcare information management services, which is a specialized segment of the IT BPM industry. And it supports the global healthcare providers, insurers, and digital health companies. So it is but fitting and proper that the Philippines sends a delegation to attend this year's HIMSS conference. And guess what? FilipiNARS is honored here tonight to have the Philippine delegation here as our guests. So we have Mr. Vincent Remo, Mr. Julian Valenzuela, Ms. Celeste Ilagan, Ms. Joy Alguzo, and Ms. Kat Rivera. I got that right. Oh my God. Welcome, everyone.
Thank you for having us.
Thank you. We so appreciate it. And because you are very important, I'm going to ask you one by one what your agency is, what your mission, what the mission and goal of your agency is, so that our listeners will know why is it that you're here, right? Okay, well, let's start with Mr. Vincent Remo. He is the chairman of the BOT and HIMAP, we call it. So, Mr. Remo?
Happy to be here. Thank you for having me. I'm Vincent Remo. I'm the chairman of HIMAP, Healthcare Information Management Association of the Philippines. And we are an industry association composed of around 100 companies who are supporting the U.S. healthcare delivery services from the Philippines. As of now, a total of around 210,000 workers are in our industry in the Philippines, working remotely from the Philippines, helping the healthcare delivery system remotely, from healthcare delivery system of the United States, but working in the Philippines. So those are the companies that are members of our organization. And as an industry organization, what we do, or what we aim for, is really to create opportunities as well as to empower our members so that the healthcare ecosystem of the country of the Philippines will thrive for years to come.
Very good. That's a very important agency. I can say you guys are all important people. I am so humbled. But anyway, Mr. Julian Valenzuela, he is the CEO of the Visaya KPO, which stands for Knowledge Process Outsourcing Corporation.
That's right.
And I'm being told you have a very important job.
Thank you very much for that. Yeah, so my day job is the CEO of Visaya, one of the co-founders. We are actually Nevadan, so we have an office here in the Gramercy in Summerlin. And that's our sales office, but we have 800 strong workforce in the Philippines, largely in the healthcare space. And so these are folks that work in the revenue cycle of our hospitals, helping our hospitals as well as our insurance companies here in the States collect money, right?
Of course.
And facilitate the payments system. And then we also have care managers in the Philippines. So these are both Philippine RNs as well as US RNs, who are actually practicing, talking to patients, but managing these patients from the Philippines. So we've got 3 locations there in Ortigas, Bacolod, and Dumaguete in the Philippines.
Are you local here, or are you just visiting? But you have a local office.
I am local. We have an office here in Summerlin, and I actually grew up in California, but we moved to Nevada 3 years ago.
I forget California.
To start the
Nevada's
business
much better.
Yes, and so that's
It's more fun.
That's my day job, and then of course my volunteerism is working with Vince in the association. So out of those 100 more or less companies that are in HIMAP, there are 13 member companies who are part of this delegation. So that represents the private industry and all the services that we do. But I do want to take the moment to say thank you very much to our government partners, because without them, this is one of those rare opportunities where our government and our government partners work with private industry to really extend our reach to the United States, which is our target market, right? And it's awesome that they help, with dollars to pay and fund for the booth space and the booth construction to participate in HIMSS. Without them, we would never be able to do so alone as a private company.
That is wonderful. And collaboration is really very important anyways. So,
absolutely.
Well, thank you for that, Julian. And of course, we have Ms. Celeste Ilagan. Celeste is the Chief Operations Officer of IBPAP. And you can tell us all about your agency, right?
Sure. Thank you, Doris. Good evening to your listeners. And always happy and proud to share about our IT BPM industry. Maybe first, just to put in context, there are two associations here, HIMAP and IBPAP. We are the primary trade association for the promotion, development, and growth of the IT BPM industry in the Philippines. And not many probably know about our IT BPM industry, and I'd like to share that with your audience.
Yes, go ahead.
We are a huge industry now. 1.9 million Filipinos are working in this industry, and we have become a major pillar of the country's economy. We generate some 40 billion US dollars with 2025 records, and that is actually a feat, and we do that every year. So among the things that we are able to do for the country is really to create a lot of jobs, and as I said, export revenue. And as an industry, we have 6 subsectors. HIMAP is one of them. Another one, which is a bigger segment, is the contact center and BPO segment of the industry. And I'm explaining so that you understand the depth and breadth of the IT BPM industry. So that's the contact center and BPO. There is also what we call the global capability centers. And these are multinationals that set up in the Philippines to service their regional or global offices.
I see.
The back office operations, even front office operations, are delivered out of the Philippines. We also have, as part of the industry, the IT and software development, and of course HIMAP is there, and there are 2 subsectors that are more creative than technical: animation and gaming development, also part of our industry.
Wow.
Yeah. So it is a huge industry, and we continue to grow. The US is our primary market for investors and also for clients, and we are here to make sure that the name of the Philippines continues to be up there as a destination for this industry.
Of course. So what other countries are you working with?
Exporting,
the United States is one of your biggest users.
70% of our market is the US, and second will be Europe, and companies from Asia Pacific. And right now we are developing the Japanese market, and we continue to explore new markets because the service of the Filipino BPO workers is really good for any country in the world.
Very good. Wow. It's really grown so much, IT BP.
Yeah.
Anyway, well, thank you for that, Celeste.
Thank you, Doris.
Let's go to Ms. Joy Alguzo. Ms. Joy Alguzo is the Deputy Director General of the Philippine Economic Zone Authority, otherwise known as PEZA.
That's
Joy,
right.
go ahead.
Hi, good evening, everyone. Good evening, Doris, and it's an honor to be invited in your
thank
program. Okay, so PEZA is an agency attached to the Department of Trade and Industry. We take charge of attracting investments to the country to generate employment and exports. So we're now catering to various sectors. We started with manufacturing. We're very strong in manufacturing, and also into services such as HIMAP or healthcare, and IT BPO. We are now hosting more than 4,000 companies hosted in more than 400 ecozones all over the country. So American companies are there inside the economic zones and so on. So we are here to support the industry because this is one of the fastest growing industries in the Philippines. Of course, we need the jobs for our Filipino countrymen. And as Julian said, the government is there to support. This is a collaboration to promote the sector and tell everyone the type of work that the Filipinos are able to do.
Yeah, and outsourcing is really primarily very important these days because, you know, if you're a small business or whatever, you can't afford to have all these people. So if you outsource, it's a little, well, cheaper
More
or
efficient.
more efficient, more cost effective, I should say, right?
Yes.
Okay, very
Definitely.
good. Okay, well, thanks for that, Joy. My sister's name was Joy. Anyway, well, Miss Kat Rivera, let's hear from you. Kat is the Assistant Director of the DTI Export Marketing Bureau. Okay,
Yeah.
tell us all about your agency.
Yeah, so the Export Marketing Bureau, or EMB, is a bureau under the Department of Trade and Industry that is mandated to support export development and promotion. So basically, we provide services to our exporters from even before they export up until the time they're able to go somewhere else, and their products and their services go to different markets. So part of those services is actually trade promotion and supporting the industry, the services sector in this mission to HIMSS is part of that trade promotion effort. So,
Okay, so thank you for that. I mean, it boggles my mind that all of these agents, because I haven't been in the Philippines for a long time, and I'm so glad that, you know, these agencies are out there helping the economy. So do you all collaborate with each other and have you know, work with each other or have conferences with each other, stuff like that?
Yeah, I share your joy because
Yes.
we're also very, very fortunate to be supported by our government partners.
Yes.
And we, as Julian mentioned, we may never be in this HIMSS conference if not for the support of the government. And so what we do on the industry side is we put equal effort to the work that we do, to the preparations. We bring as many companies as we can so that we can introduce to the world, we can make it known that the Philippines is really the hub, the global hub for healthcare information management excellence. And that is what we're aiming for. That's our goal. Our end goal, really, we have a roadmap actually up to 2028 to grow this
Fantastic.
industry. So we're now at a little over 210,000. We're growing it further. We hope to reach around maybe 300,000 in the next 2-3 years. So we keep on growing, and as we keep on growing, we keep on getting the support of the government. So it's a win-win situation for the industry, well, for the government, meaning more jobs for the people, and also more opportunities for our nurses, for our allied medical health workers. To be, you know, to have a choice of whether they want to go abroad, they want to work abroad, or they can stay in the Philippines, earn a living while being with their family in the Philippines.
Right.
So there's a lot of wins by doing this, and we want to promote it through through shows and exhibits like HIMSS.
Yeah, actually, I know a home is an infusion company, but it's, you know, they do patients and see them in their clinics. But the people that follow up these patients are basically in the Philippines, which is, I am like, really? Wow, that's great. That's wonderful, because here, if you go to a healthcare facility, you probably see maybe 40% of the staff are Filipinos. I mean, who don't like Filipinos? But anyway, but I am so glad that now IT is up and running and up and a very important part of the industry.
Yes, absolutely. I mean, it's only through technology where you can actually reach the talent that we have in the Philippines, right? And the Philippines has been known already for the last 20 years for being the call center to the world, so to speak.
Yes,
right?
yes.
And so that's basically in voice and non-voice work. In the healthcare space is our attempt to go up the value stream in terms of the sophistication of work that we do. So this is not purely customer service, but you're actually working with patients in the healthcare space. Or let's say you're also in the revenue cycle, which is everything from charts collection, billing and coding, clinical appeals, through the gamut of the RCM cycle. All of that is just to say that we have the domain expertise in the Philippines. Why not marry the contact center reputation that we have, along with being the #1 producer of USRNs outside of the United States, comes from the Philippines. If we put those two together, then that's been the secret sauce and the success of our association and the
Kentucky
members.
Fried Chicken secret sauce.
Exactly.
That's good. That's wonderful. And technology has really helped a lot. When I graduated nursing school, technology was nowhere it is right now.
Right.
But anyway, so I have questions for you guys, and you guys can tag team or you can answer individually. What does your agency's participation in the HIMSS Global Conference mean to you? What do you expect to take back from from this conference?
Maybe I can start. Yeah.
Yes.
For us, it's really to bring more business for the Philippines, and then for these companies to gain more clients, so we can export more services. Because for the government, of course, we want to significantly increase our exports in goods, exports in services, and this is one of the industries that has high value in terms of the services they provide. So participating here and supporting these companies and this association is really is important for DTI.
Very good, very good. Do you have anything to add to that?
Yeah, sure.
Celeste,
So promoting the whole IT BPM industry is among the mandates of IBPAP, and certainly aside from healthcare information management, we would like the world to know about the 5 other subsectors that we are strong at. But in this conference, we'd like to make sure that the Philippines' reputation as the primary destination for healthcare outsourcing is further strengthened. What we'd like to happen is to get more clients for existing healthcare information management operations in Philippines, and also new investors in the space. And we see that there is a huge potential to get these companies to know more about the Philippines, and therefore choose to expand or set up new operations in the Philippines. But before I finish, I would just like to go back to the topic of government and private sector connection, so that that this industry did not just happen by chance. There is that government and private sector strong collaboration. Why this happened? And Julian mentioned that 2 decades ago, we started promoting the Philippines as an IT BPM destination around 25 years ago. And at that time, we said that we can make a name for ourselves in the contact center space. That was very deliberate.
Call center,
yes.
Because of the strength in English, the strong customer service orientation. We have the people who can really do the job. We had infrastructure that will support the industry, and also the strong government support. The first mission to the U.S. to bring clients to the Philippines was organized by government, and always we had private sector players invited to speak, give their testimonials, and there is always the intention of supporting the country first rather than promoting their individual companies, and we are very grateful that it is always like that from 25 years ago to today. It's that close collaboration. There's really no competition when we are all here, and when clients go to the Philippines, that's when we show what we all can do, and therefore the client can choose which is the best partner for them.
Yeah, and it's really amazing because, you know, like you said, Julian and Celeste, a few years ago, my one of my nephews is working, he's still working in a call center. So at the time, it was like, I think this is the only thing that is part of the healthcare or that we can help, you know, outsource. But now I'm hearing there's other factors in the industry in healthcare, like IT, for example, and your follow-up with patients. So we have a lot to offer, right? We do.
We do. Yeah.
That's
The
good.
whole range.
Yes. And so we all know and acknowledge, and I think we sort of kind of answered this question already. We all know and acknowledge that IT or information technology is crucial in every business. And some IT jobs are, of course, outsourced to the Philippines, which we already did. So aside from the call center and IT functions, are there any other functions that that's being outsourced to the Philippines
Sure.
that you know of?
Let me give a perfect example,
Yeah.
a real-world example. So Visaya being Nevada, and I'm very proud that we actually manage one of the care plans here in Las Vegas. So I can't mention the company name, right? But it is a well-known insurance company that manages the population health of Las Vegas. And in order to do so, we've got USRNs who are licensed in the state of Nevada, who are working, like I said, in Bacolod. And so that gives you the sense of complexity of work, because these folks actually have clinical experience. They've worked in hospitals before, but now they're able to do so through the use of technology to actually talk to their patients through technology from the Philippines. And, you know, instead of earning a call center salary, they're actually earning a full-fledged healthcare salary in the Philippines, which is 3, 4, 5 times higher than the average call center agent, right?
And they get to live there.
And what you need to understand is, you know, these folks, and I tell them all the time, yes, you're USRNs. I'm a real advocate of reverse migration because I grew up here, but I was able to see how the call center industry in the Philippines grew. And so I'm a believer in the reverse migration and how do we keep families together?
Yes.
How do they get to enjoy the Philippines, right? But at the same time, do what they do and ultimately earn really, really well, because as we all know, cost of living here in the States is so expensive.
It
It's
is.
not the top line number of what you earn, but actually the bottom line number of what you get to keep at the end of the month.
Correct.
These folks get to keep a lot more because they get to live in the Philippines, be with their family, and become nurses and practice their
And
expertise.
their craft, right?
Yeah.
But, and that goes to the fact also that they have acculturated here from a healthcare standpoint, so they know what the conversation is and
Yep.
how to how to care for the patient, what's the care plan, with the business, as opposed to if you were looking at a patient from a Filipino culture standpoint.
Absolutely. So
Yes.
these folks are well trained, and we all know the Filipino is well known for their malasakit, right? And we are the best folks in terms of care
Yes,
worldwide.
yes.
And that's the brand that we carry, the flag that we carry, the pride that we have in the healthcare workers that we have.
And that's always what we hear is, Filipinos are always very friendly and and the food. Okay, let's not forget the food. Okay, so can you give a perspective of the status of digital health in our country, like the telehealth platforms? I know that here, like if you were a nurse practitioner, you can actually talk to your patients, remotely. So is that happening at home as well?
Well, especially during the pandemic, that happened a lot. If we compare the systems that's being used here in the United States versus in the Philippines, there's a big difference still. But the concept of having telemedicine, telehealth is already being adopted in the Philippines, and it's nice to know that the Philippines is one of the high tech or user one of the in terms of population, the population of users of technology, we are on top, almost at the top of the list,
including social media.
In social media in particular. So, having said that, I know that we are open as Philippines to further improve on this. We also have some companies in the Philippines who can develop the software for it, the platform for it, other than being able to run it. So I guess we're just a couple of years behind, but we're gonna get there now.
Yeah, I think we're gonna get there. How about like electronic medical records? Do you have that now? We have that now too.
We have. Well, right now the setup is there are the large hospitals in the Philippines are using some of the same systems that's being used here in the United States, but some of the hospitals, they would have their own maybe customized EMR for their own operations. So again, it's a couple of years behind in terms of adoption of the technology, but it's already there. It's starting, and we're actually trying to work it out also with our government partners for the Philippines to really adopt the electronic medical records one way or another in some form of technology. But we also need the drive from our government agencies to really make this happen in the Philippines.
Yeah. So in here we still use hybrid models and stuff like that with the electronic medical records. I know some hospitals or some doctors can talk to each other. So, if there's a patient here and they can compare it with the patient there. So I'm looking forward to seeing that in our country.
Yes, and what's good about the Philippines is we adapt. We are good at following good examples, getting the best practices, and adapting it. And customizing it further for the need of the country, for the need of our fellow Filipinos. So, I'm confident that we're gonna get there.
Very good. Yeah, I am too. Hopefully, I'll still see that day. Okay, so in you all know AI, which is artificial intelligence. In what areas you think is AI predominantly used in the Philippines?
Well, I can speak for the healthcare industry and keep me honest here, Julian. We are already using it in terms of, Julian described a lot of services that we're doing in the Philippines, even including medical coding, medical billing, the likes of somewhere along the revenue cycle process, there's AI that's already integrated there. It's because, our counterparts in the United States are already implementing those AI tools, AI platforms.
Right.
But what happens is you still cannot remove the human in the loop.
Correct.
There's so right now the positioning of AI, it's more of an assistant to our nurses to make them more efficient, meaning they can do more with less time because somebody's or an AI is helping them. So that's the positioning right now. Of course, the plan or the future. In the future, it is said that most probably some of the jobs to be taken over, and right now it's also happening.
Right.
The simpler jobs are being taken over. But what's good about the Filipino nurses and the Filipino companies is that we are very resilient in nature, and we see it as an opportunity to move up the value chain, the value stream, so that we can offer higher level services, and we can further show the capabilities that we have even from the Philippines.
Yeah. And when I went to school, of course, they didn't have any apps or anything. Now, if you have any question, you just say, "Hey Siri, what is this?" You were going to say something?
Yes, I was going to say that for the industry, the biggest users of AI is our contact center and BPO space.
Oh.
When Chat GPT became a household term in late 2023, there were predictions that our industry was going to be decimated by AI. The contact center industry was going to be gone. And the industry has been using AI for many years now. And what the industry has done is really to use the technology to make service more efficient, make the people more productive. Automating processes is always part of what we do so that we can serve our customers better, faster, and cheaper. And therefore, if there are we call them repetitive transactional functions, that will really be eliminated by AI. And the person, the human aided by AI, can do more complex things that can be paid even more by clients. So this is really an opportunity for us to, as mentioned earlier, to move up the value chain. And I'm the person who likes to go back so that we complete the big picture for our industry. You asked about what we are already doing in the Philippines. So healthcare, deep dive already earlier, IT, but there is this subsector of the industry that I'd like our Filipinos to appreciate. And this is the global capability centers. As I said, these are multinationals who have set up operations in the Philippines to serve their own requirements. And I will not mention the names of these companies, but the biggest banks in the U.S. are in the Philippines. One has 25,000 people, so these are actually employees of that bank doing everything from answering their customers, risk management, treasury, all of those being done out of the Philippines. And it is not only banks. So there are fast FMCGs, logistics, marketing, all of those back office functions are being delivered out of the Philippines. So if some say, the Philippines is for contact center, it's not true.
Not.
We do the whole gamut of services, and we have been known really as the second destination to India, not because we are how should I say it, we are lower in terms of what we can do, but just in sheer number, because India as a country is a lot more than Philippines. What is being delivered out of India is being delivered out of the Philippines as well.
Okay, very
Let me
good.
just add something,
Joy.
Doris, on AI. In the economic zones, so they talked about the healthcare space and IT. We're very strong in manufacturing, advanced manufacturing. And in the zones, the number one industry is semicon and electronics. A lot of these companies are using AI, even robotics. So they bring in their technologies from their parent company to the country, so that there's also transfer of technology for our people. And yes, AI is highly used for many years now. I am surprised when we visit some companies and how the robots are doing something and how AI is being used. So I just wanted to mention that.
So it's really a big impact. AI, IT, and digital health is causing a big impact in our country as well, right?
Oh, yes. Yeah. I mean, if you go to the floor of this HIMSS conference, AI is definitely the buzzword, right? And what does it mean for our industry, for a small company like ours? There's fear that it can, ruin our business. But truth be told, because we are the experts of our clients' processes, we are the best to actually help implement these AI processes for our clients. So we've become service providers, AI service providers to our clients, right?
To your clients, right.
So when we have, let's say, medical coders, these are CPC certified, AAPC certified, US certifications in order to actually apply code. For our clients that still do it manually, we are the ones who are introducing AI as a tool to help these coders become the first level of review. So the machine, the AI actually does the summarization of the chart and actually applies a code. And then our coders come in as the second line of review. They do the quality assurance, making sure that the machine actually did the right assessment. Right, and you can't really trust what that machine says. You can't turn over the expertise that our Philippine coders, who have they even have medical expertise, clinician expertise, to analyze that chart and make a determination: is this really the right code? So it's a combination again of IT as well as human domain expertise as the complete package that we give to our customers.
Very good. So I know this is a show about FilipiNARS, NARS being nurses. So I have to ask you, and I don't know if you would be able to answer this. From a nursing standpoint, what do you think is the biggest impact that this has caused in the Philippines? AI, IT, and digital health.
Well, let me take a stab on the question. Technology is always for me, technology is a tool. It's for a carpenter, it's a hammer. You know, you have to be able to learn to use it.
Sure.
But again, at the end of the day, the person, the nurse, for example, is at the core, at the center of it all. The service being delivered is, care for human beings, and you cannot do that, as Julian mentioned, by purely AI.
Correct.
You have to have at the center of it all, at the core of it all, is the skill set of the nurse, and it's up to that nurse how to use technology to make her work or his work easier. Okay, and then having that in the as the base of all these things, you can now do more with less time, and you can now think of ways on how to improve the services, improve the care, and balanced with that, the Filipino nurse very much known for empathy, for the malasakit. That's the secret sauce, if you may say so.
Yes.
That's the ingredient for success specifically in the healthcare field. Not only healthcare information management, but on the actual healthcare delivery itself.
Yeah, that's very good. I know here in Nevada alone, we have a lot of nursing educators in here. And we even have people here who are doctorates in DNPs in the nursing field that are pretty high up there with regards to the national organizations, as well as even with the tests for the nurses. So we are really, very proud of that. I mean, I write for the paper, and I still, I use AI. I compare my writing and what AI says, and then I combine it and see which one is the best. So it really is, I don't know, heartwarming to know that I'm not the only one using it. Okay, well, I am so glad that you all are here. But let me ask you, all of you, each one, what is your wish list from your agency's standpoint for the improvement and enhancement of IT and AI? What's your wish list, moving forward? Let's start with you, Kat.
Wish list. Basically for us, just going back on the discussion of AI for good has been one of the things that we always tell our stakeholders. I mean, it's a tool. So applying it to the industry to make the industry of higher value in terms of providing the services that of the Philippine companies. So probably that applying AI to and emerging technologies to improve the services that we provide.
Very good. Ms. Joy, what's your wish list?
I guess for me, it's really skills development, because as Vince mentioned, the workers would need to adapt and catch up. Sometimes a company would introduce a tool, a system, and you're already employed, so you would need to learn quickly.
Right.
So in PEZA, we actually set up the first AI Academy. So this is not just for walk-ins, but for employees of the economic zones or the IT sector, so that they can learn the basics. There are certain levels, so that's our way of helping develop and increase, level up the skill in terms of AI of our Filipino worker.
And hopefully you will also consider the seniors and the older population, in orientation to this, because that is a huge challenge. Yes, it is a huge challenge. Okay, Miss Celeste, what is your wish list?
Yeah. Definitely my wish list is to be able to bring more investors to the Philippines, and for these companies to bring with them the best possible AI that is used ethically and responsibly.
Correct.
Because there's no stopping what new AI
Can do.
products will be out there.
Right.
It is up to the users how to use this AI responsibly, so that what they do will be good for the industry, good for the country, and good for us as human beings, I guess.
Very good. Julian,
Yes.
what do you think?
So my wish list for HIMSS, I think, is on two levels, right? With my company hat on, of course, the selfish wish list is to find more clients for the for the company, and that's why we participate in this conference. So my shameless plug is, please come to visayakpo.com. For any of those of you listening, if you need contact center work, or if you have revenue cycle work, medical coding, billing, and the like, or even care management for hospital groups, please reach out. But then on the non-selfish version, right, my association hat, again, I'm an advocate of reverse migration, right? And Visaya is Filipino-owned, proudly Filipino-owned, Filipino-run. And that's a rare thing in our industry today, because they do such a great job finding foreign companies to invest in the Philippines. Very few Filipinos do the same investment. And so we've done this for 18 years now.
Yeah.
And my goal is, how do we create more Filipino jobs? These are high value, high paid jobs, right? I have to pay top dollar for Philippine workers to stay in the Philippines and, be able to be proud of the work that they do.
Yes.
And then, not leave. There's no brain drain to the Philippines.
Right,
And that's something that, I believe in that very strongly, to the point that I've moved myself and my family back to the Philippines to do this
Okay.
as a mission.
We don't really call it brain drain now, I guess, because of that reverse migration you're
Right.
saying. But the brains of the Filipinos are one of the
Absolutely.
biggest exports, right?
Absolutely.
So, well, thanks for that. I appreciate that. How about you, Vincent?
All right, my wish list. Actually, let me just go back. When Julian mentioned about his company, I remembered what Celeste was saying, that we are more into promoting the Philippines, and I forgot to mention my company. I'm the chairman of HIMSS, but the one paying back my
Kalimutan mo, ha?
my paycheck is actually ADEC Innovation. I am the senior vice president for operations in the Philippines, and my wish list now, first and foremost, is for the country to be known, to be well known as the number one or the best country that would have the combination of AI and workforce and empathy wrapped up into one, in delivering solutions and services not only to the United States but to the global market. And maybe a sub wish list to that is that for all Filipinos all over the world to stop fearing AI and learn to embrace it, learn to make full use of it, so that you'll be more efficient in everything, in your personal life, in the job that you do. And if we all do this as a country, or as Filipinos, then definitely we can help one another, bring more jobs to the Philippines, bring more income to our families, and at the end of the day, be the number one AI workforce globally.
All right. Well, what a wish list, man.
That's why it's a wish list. But I know we can make things happen, right?
Yeah,
we
it
can
may
make it
happen.
Yeah.
We can make it happen. Even Prince Charles has good things to say about Filipino
Philippines,
nurses.
there you go, right?
There you go. Yeah.
Oh, no, King Charles now. I'm sorry.
Yes.
Sorry. Okay. All right. Well, I would like for you to, I would like to ask you, what is your message regarding IT, AI, and digital health to the healthcare community here in the U.S. and outside of the Philippines, outside of the U.S.? Who wants to start?
Because it's healthcare, I will give
Yeah,
you the
the two of you.
opportunity to
Gentlemen.
do that. Yes.
All of you too.
Well,
Okay.
I've already said my wish list.
Yes.
But for your listeners, for those Filipinos who are not in the Philippines in particular, know that the Philippines has changed a lot over the years. We have improved a lot. Maybe it's time for you to visit us again.
Yeah.
See what is like to to live in the Philippines for a while, or to at least observe how things are in the Philippines, and regain that confidence in our country.
Yeah.
And if you do
Absolutely.
that, you would be the agents of change for the country. Even you would be our ambassadors to bring more jobs to the country, because you are confident that our fellow Filipinos way back the way or living in the country, living in the Philippines, can deliver an equal quality of work which is actually the same or similar, equal at level with the ones being done here in the US. But things that can be done. There are things that can be done in the United States. The core services would be here. The non-core services could be outside the United States. But all in all, it all contributes to the success of the healthcare delivery. It's everything is about the patient. The patient journey should be smooth. Okay, we're all promoting health. We are one in this journey, and I hope that our fellow Filipinos, everybody who's listening, everybody who's in this podcast, be the ambassadors of, be able to promote, at least the
Yes.
ambassadors of change, promote the work that we do, because we're here for you. We're here to support you in all of those endeavors. So, yeah.
Thank you
Here,
so
here.
much.
Well said.
You are so inspiring.
Well said. My
Anyway,
answer
I
is
also
just
want to-
ditto. No, I will not follow that. That's very well said.
Very well said. Miss Celeste?
No, I gave my skill to him. Yes. Thank you.
Okay, Joy?
Oh, no.
I
just want to applaud him.
It's very good. Yeah.
Okay, very good. And Kat, you're saying him the same thing?
Yeah,
Or-
just the
Yes.
same. And also to add
Yes.
that if you are in Las Vegas, please visit the Philippines Pavilion. Yes.
Yes.
Until tomorrow.
Until tomorrow.
It's until tomorrow.
It's at the Venetian in the exhibits center.
Okay.
We're booth 4353.
Okay, so you all heard that the HIMSS Global Conference is at the Venetian until Friday.
Until
No,
tomorrow.
Oh,
Thursday.
until tomorrow, Thursday,
Thursday.
March
12.
Okay. But next year, you're coming back again.
Yes.
So I'm looking for, maybe I can join you guys next year.
Yes.
So next year it's
Forward to that,
it's
Dora.
actually in Chicago.
Yeah.
I think it's the first week of April.
First or second week of April.
Yeah, and we've already chosen the booth, and so
Cool.
this is an open invitation to PHLV Radio to join us in Chicago to promote again what we do, and
Yes.
we'd love to give you another year update of what has transpired
That's
between now and then.
That's wonderful. And this is going to be your venue, FilipiNARS. I'm there. So
Wonderful.
Thank you.
Okay, you're welcome. Well, ladies and gentlemen, I thank you so much for gracing our program tonight. It's a pity that we don't have, X number of hours to expound more on what you do, but you are so inspiring. I'm so inspired by all of you. So we do appreciate you taking the time, and all your agencies actually play a very important role in the development and sustainability of IT and PBM in our country, right? So thank you so much again.
Thank you.
Well, thank you for having us.
Thank you.
Yes,
Thank you.
anytime. Okay. And to our listeners and followers, I will sum up the concept paper of this Philippine delegation. The Philippine delegation, composed of leaders from the Healthcare Information Management Association of the Philippines, the Department of Trade and Industry, the Philippine Economic Zone Authority, aims to promote the Philippines as a strategic partner in the global healthcare ecosystem. Economic significance of the healthcare IT BPM sector. Healthcare information management is one of the fastest growing segments in the Philippine industry. So the national economic impact for the Philippines is huge. Okay, the continued growth of this healthcare IT BPM sector contributes to an increase in the service export revenues. It contributes to higher value employment opportunities, to regional economic development through IT, parks, and economic zones, and enhanced global reputation for the Philippines' healthcare, talent, and digital capabilities. So through initiatives which is actually led by our government in the Philippines and the stakeholders and you leaders, the leadership actually in information health management can expand its global role in the healthcare technology ecosystem. So mabuhay ang Pilipinas. Mabuhay. Okay. Well, thank you so much for joining us today. Please be safe and be well. Until next time, this is Doris Bauer, your FilipiNARS host, signing off for now.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.